Someone I know is scheduled to undergo angioplasty in the coming week. And it has led me to reflect and think about the relationship between cardiovascular disease and diabetes. Karamihan ng mga tao who are diabetic, eventually, they develop as well cardiovascular problems. Now ang tanong, bakit? Bakit nangyayari yan? That's the question that we will try to tackle in this video today. Diabetes is characterized by insulin resistance. What does it mean? Insulin resistance means that more than the normal amount of insulin is required to clear the excess glucose in our bloodstream. We have to remember that the main function of insulin is to clear excess glucose in our bloodstream. So, sa sinabi na natin, pag insulin resistant yung tao, yung normal na amount na insulin which our pancreas produce is no longer sufficient to clear the excess glucose in the bloodstream. Ang tanong, bakit? Bakit naging insulin resistant yung tao? Normally, the cause of insulin resistance is chronic high level of blood glucose. That means pag palaging mataas yung blood glucose natin, eventually, that leads to insulin resistance. At pag palaging mataas yung blood glucose level natin, it causes as well blood vessel inflammation. That means yung mga ugat kung saan lumalatay yung dugo natin ay nagiging namamaga. And if our blood vessels ay palaging namamaga, eventually, doon kumakapit sa lining ng blood vessels natin yung cholesterol, which later on develops into plaques, which later on causes the clogging of our blood vessels, which later on causes the clogging of our arteries, which later on will cause heart attack. Now the question is, how can we prevent all this? How can we prevent blood vessel inflammation? How can we prevent plaque buildup? How can we prevent clogging of our arteries? How can we prevent heart attack? Very simple. What causes blood inflammation? Excess glucose. So we just control the amount of glucose in our bloodstream, and we control vessel inflammation. We control plaque buildup. We control the clogging of our arteries, and we prevent heart attack. Now the question is, what causes the presence of excess glucose in our bloodstream? Again, we have to remember, every time we eat, especially if we would be consuming carbohydrates, and particularly sugar, this food, they're converted into glucose. Glucose comes from carbohydrates, and particularly sugar. So then, to avoid blood vessel inflammation, it's very simple again. We just control our consumption of carbohydrates, control our consumption of sugar. At pangalawa, may iba pang mas mabisa sa fasting. Is there a better way to reduce glucose than to fast? Because when we fast, that means no carbohydrates are entering our body. And if there's no carbohydrates and sugar entering our system, then no excess glucose. So then, to avoid blood vessel inflammation, to avoid plaque buildup, to avoid clogging of arteries, to avoid heart attack, it's very simple. We reduce consumption of carbohydrates, reduce consumption of sugar, and number 2, we fast. A fasting period of at least 16 hours will clear the excess glucose in our bloodstream. That's how we can prevent clogging of arteries. That's how we can prevent heart attack. It does not cost much. Actually, it does not cost us anything, but will prevent heart attack, which is now one of the major causes of deaths in the country. Thank you.